Okay, so check it out because this is like crazy awesome and so empowering. In 1996, an orthopedic surgeon by the name of Bruce Moseley, who also happened to be a leading expert in orthopedic sports medicine, published a study based on his experience with 10 volunteers. All of the volunteers were men who had served in the military and suffered from osteoarthritis of the knee. Because of the severity of their condition, many of these men walked with a limp, needed a cane, or needed some sort of assistance to get around. The study was designed to look at arthroscopic surgery, a popular surgery that involved anesthetizing the patient before making a small incision to insert a fiber optic instrument called an arthroscope. The surgeon would use this instrument to get a good look at the patient's joint. In the surgery, the doctor would then scrape and rinse the joint to remove any fragments of degenerated cartilage that were thought to be the cause of inflammation and pain. But check this out. In Dr. Moseley's study, only 2 of the patients would get the standard surgery where the surgeon went in and actually scraped away strands of cartilage from the knee joint. 3 of them were to receive a procedure called a lavage. This is where high pressured water is injected through the knee joint, rinsing and flushing out any decayed arthritic material. The other 5 would get sham surgery, where Dr. Moseley would slice through their skin with a scalpel, but then simply sew them back up without performing any medical procedure at all. For those 5 men, there would be no arthroscope, no scraping of the joint, no removal of bone fragments, and no washing, just an incision and then stitches. The start of each of the 10 procedures was exactly the same. The patient was simply wheeled into the OR and given anesthesia as Dr. Moseley scrubbed up. Once a surgeon entered the OR, he would find a sealed envelope waiting for him that would tell him which of the 3 groups the patient on the table was randomly assigned to. Dr. Moseley would have no idea what the envelope actually contained until he ripped it open. And this is the crazy part. After the surgery, all 10 patients in the study reported greater motility and less pain. In fact, the men that received the pretend surgery did just as well as the men that received the standard or lavage surgery. There was no difference in the results even 6 months later. And 6 years later, when 2 of the men who received the pretend surgery were interviewed, they said they were still walking normally, had no pain, and had greater range of motion. They said they could now perform all the everyday activities that they couldn't do before having the surgery 6 years earlier. They felt as though they had regained their life. Dr. Joe Dispenza questions, is it possible that these men got better simply because they had faith and belief in the healing power of the surgeon, the hospital, and the OR? Did they envision a life with a fully healed knee, surrender to that possible outcome, and then literally walk right into it? We can heal ourselves.